Dear respected brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh. First, I would like to thank you all for inviting me for the second time to this institute to help shedding some light for very important issues going on in the community and help to educate our community about this problem and help with solving the problem itself. I would like this lecture to be not kind of classic lecture. You can get all the information from the internet. I want it to be more interacting. So we ask questions and answers, and in this case, we learn from each other more. First, I want to know who was here in the first lecture. Can you just raise your hand? Okay. All right. So we have like 3-4 people here. And the first one. What we did in the first one, we talked about substance abuse in general. We didn't talk about the mental illness at all. And I believe there's a strong relationship between the two, the substance abuse and the mental illness.
The previous session was for adult, not for the teenager. Now we invite teenager.
That's one of it, that's true, because it was more educational to everybody. This one is more focusing on the youth population. So in this lecture, we are going to talk some revision about the classes of substances for the people who didn't attend the first one. And also we're going to talk about the mental illnesses. You will hear this term a lot and what mental illness means. And is there any relationship between the two? Why we are talking, when we talk about the substances or drugs in general, we talk about the mental illness. And when we talk about the mental illness, we mention drugs most of the time. Is there any relationship between them or not? And also I have some real cases from my own patients. And I would like to share the information of those patients with you to have some idea about the exact nature of this problem. And also we need to talk in our discussion how we are going to protect our community. If we believe this is a problem, what we need to do about it. How we can, identify the problem before it get, bigger and become more serious and out of control. And who is responsible for that? Is there anybody in particular responsible, or we are all sharing the responsibility, the families, the community, the health system, the school, or all the community mental health agencies as well. So going back with a quick revision about the substances, we talked in the last lecture about alcohol. And everybody knows alcohol, and it's legal substance. Everybody has access to it, unfortunately, but has a lot of problems: medical, social, economic, and even mental, general health problems. The substances, ranging from some that we are all use, like caffeine or tea or some other stuff, to major problems that might cause death. Other substances mainly used, the cannabis or marijuana, hallucinogens, inhalants, opioids, and I put opioids in red color because it's very important, and a lot of youth, God forbid in your age, they lose their life suddenly because they get hooked up with these drugs, and their family, they just find them dead the next day without any obvious reason. Other drugs, they are sedatives like Klonopin, Ativan, Valium, all kind of hypnotics, and anxiolytics, which means the medication used for treatment of anxiety. And tobacco is one of the substances, but we are not going to focus on that. It's more health issues than mental health problems. You might hear these terms, substances. What substance means? It's like drugs, but the medical term for it, we call it substances. And substance abuse means somebody who get dependent on this drug. Substance dependence, people who have withdrawal symptoms when they stop these drugs. Like if somebody is using opioids or using alcohol or any other kind of drugs, If they try to cut down in the amount of the drug, they feel they cannot do that because they will have physical symptoms. And these physical symptoms depends from one drug to another. For example, if we talk about opioids, they will have chills, cramps, sweats, nightmares, restlessness, and anxiety. All these are withdrawal symptoms from this substance. I'm not going to focus on one substance because this is more like talking in general, tips about each one, and then we talk about it in details in the discussion part. When the substance use become a disorder, people, they spend a lot of time. I usually tell my patients their brain is wired about the drugs. So you see they are spending a lot of time, they are going around searching for drugs, they sell their own stuff, belongings just to get drugs. I've seen cases, girls, they sell their own body, unfortunately, they involve in prostitution just to make money. Guys, they steal from their own family, they go to jail just to get the money ready for the drugs. So all their brain wires about the drugs. All the time they spend about the drugs. Everything they think about it is about the drugs. They try to cut down on these drugs, but they are unsuccessful. They try to use more in each time to obtain the same level of effect of this drug. So in this case, when they reach that point, we call it disorder. That means there is sickness. They need to be treated. So if you hear the term substance use disorder, that means somebody who is dependent on the drugs and they cannot stop the drugs unless they have some help with that. So the consequences of drug use, you see a lot of problems in their work, in school, in home. Psychological problem happens, social problems, fight in the family, poor personal relationship. They lose the social interaction with others. Nobody wants to be around somebody who is labeled as a drug addict. A lot of people, they lose their job. They dropped out the school. So it's disaster. There is no win in this game. There is social, there is mental, there is physical, there is legal consequences. And they don't care because their judgment is so impaired. So they use drugs in very, abnormal situations, and despite of the physical or psychological problem, they continue to use because they cannot stop it. If they stop it, they will have the withdrawal symptoms. And the reason they have withdrawal symptoms, which I just mentioned about the symptoms, the physical symptoms, because they develop tolerance to this medication, or a drug in general. For example, if they are using Percocet or Vicodin like 10 or 5 milligrams, and they get some euphoria, and they feel they are high, the next time they need 20 or 30 milligrams, then 60, then 100. So each time they need to build up the milligrams to reach the same level of euphoria. And unfortunately, in this case, they are very prone to have substance intoxication because their judgment is impaired. So they don't know how much they need. And the next day, they find them dead. And I've seen a lot of examples of that. I run the Suboxone program in Arrowhead Behavioral Health in Maumee, Ohio. And a group like this number, or maybe a little bit bigger than this number, and each time one of the clients mention either a friend or family member who is in their 20s or 30s, and they lose their life, they are quite healthy. They don't have any problem, never been sick, they didn't go to the doctor because they are very healthy, but all of a sudden they lose their life. So it's a real disaster, because once they get hooked up to the drugs, they don't know when to stop. Around 8.9% of the population, they are using drugs. We mentioned that in details in the previous lecture, but I'm just going to mention that for the people who didn't attend the lecture. Marijuana is the commonly used drug, and some people, they believe it's okay to use marijuana because now it's legal in certain states and it doesn't have a problem. Actually, no, this is not the story, because marijuana does a lot of problems to the central nervous system, to the heart. An increased norepinephrine in the blood might cause high blood pressure, might cause stroke, and also impaired judgment, and other problems might cause depression and anxiety. It's recommended for certain cases when people, they have cancer, they have like severe loss of appetite or weight loss, and it's controlled in these situations. But if you say, go ahead, use marijuana from the street, that's not true. This is a picture which shows how the neurotransmitter get affected and how the dopamine pathway. I don't want to bother you with this because it's more like we talk about it for the medical school students. But for you who are interested to know about why do we get dependent on drugs, why is that? Because there's what we call the dopamine pathway, or the dopamine pathway or rewarding center in the brain. Dopamine is one of the neurotransmitters in the brain. It helps to give you more motivation, energy, euphoria, pleasant feelings. So when you use a drug in general, most of these drugs, they squeeze the nerve endings and they give you more dopamine in your central nervous system. So once you have this gush of dopamine, you feel euphoric, you feel on the top of the world, you are invincible, you can do many things. You are a superpower person, whether man or woman, and at the end, actually, you are depleting the dopamine in your central nervous system. So after that, you develop severe depression, anxiety, restlessness, and you cannot control that unless you get the same drug, you get used to it. So this is, in a brief, the reason or the pathophysiology behind the drug dependence. For alcohol, almost $300 billion, spent for the treatment of alcohol and the alcohol-related problems. If you look at the number, this is a scary number. This is a huge, economic issue. 13 million require treatment for alcohol every year in the hospitals, just for alcohol and its problems. In general, 5.5 million require treatment for different drug use. 2.5% of the population, they are using the drugs in a certain way, but some of them, they get hooked to these medications in a way. Almost 40% of the admission to the hospital. If you go to any hospital and, for example, they have like 100 admissions today, you will see 40% of them, they are admitted because of alcohol or drugs or something related to that. 25% of the deaths in the hospital. So if you look at these numbers, it's really, crisis, it's disaster. 100,000 deaths per year, either related to drugs or alcohol. 50% of the road traffic accident happened. If you look at it, you see like 50% of them, either they were drunk or they were using the drugs. 50% of the domestic violence problems happened in our community. And our community is not immune from that, unfortunately. So we have really to talk about this in a very serious way. 50% of the domestic violence has to do either with the drugs or with alcohol. And murders. People committed a crime. You see either the victim or the perpetrator was hooked to drugs or alcohol. Stimulants is one of the drugs we talked about last time, and stimulants, like amphetamine, methamphetamine, cocaine, and this is very important because I have seen a lot of the college students and high school students, they hooked up to Adderall, Ritalin, Concerta, Vyvanse. Please be careful with these drugs. I know when you take these drugs, you feel focusing more, you do very well in school, you feel you have a lot of energy, you are, getting good marks, but this is not the story. This is not the end of the story. It has a lot of consequences, so be careful, our youth. cocaine in the brain, and cocaine is causing not just in the brain, causing heart attacks because it causes what we call it vasoconstriction, it's narrow the blood vessels. So if it happens in the brain, might cause stroke. If it happens in the heart, might cause heart attack. And besides, other problems with drug-related and spending money and all other consequences. Marijuana and hashish, we talked about that. And opioid. Opioid is a disaster. Opioid is a problem. I was telling Sayyid Saleh in my way here, I was listening to the National Public Radio, and there was, in the news, they said that they just revoked 35 doctors' license because of the drug prescription. There were like, don't quote me with the number because I was driving and listening to the news, but it says over 300,000 pills prescribed without medical necessity. There is no need for this drug. So when I say everybody is responsible, even us, the doctors, we are responsible for that because we have to be careful when we prescribe this medication, for pain medication especially. Opioids in general, hydrocodone, oxycodone, morphine, codeine, heroin. The classic scenario I've heard from my patients, if they have like any pain or they have surgery, the doctor starts prescribing them, for example, Percocet or Vicodin. They give them like 5 milligrams or 10 milligrams, and they don't give them like 20 pills or 30 pills. They give them 120 or 90. And this is very risky because people, they should know the consequences of these drugs. They are poison. So when they start using, they feel good, the pain relief, they feel high, they feel doing well. And then they go the next time to the doctor, please doctor, can you give me refill to my prescription? The doctor will stop, and the patient is already got dependent on the drug. They cannot stop now. If they stop, they will have withdrawal symptoms. So what's the choice? They go to buy it off the street. And they start buying these drugs off the street because it's, people, they have access to it. Either they get it from the pharmacy or from other prescribers. And then it's very expensive. So the other choice for them is to use heroin because heroin is cheaper than drugs. So they start snorting heroin. And they start snorting like 0.1 to 0.2 of milligrams, then they don't feel it's doing the same job. They go to half or quarter to half gram, and then 1 to 2, 3 grams. And then they feel snorting is not doing the job, they start injecting. And they encounter hepatitis C, HIV, AIDS, all this kind of problem. This is if they still stay alive. But during this course, they might lose their life in any moment. So again, it's a very, very, very serious problem. Sedatives, as we talk about, like Valium, Klonopin, be careful because sometimes, I feel anxious. My friend gave me Valium or gave me Klonopin or Xanax. No, don't take it. Unless it's prescribed and controlled and your doctor okayed that. Otherwise, don't take it. Because this is as worse as alcohol. It does the same chemical changes in the brain alcohol does. So this is briefly what we talk about is in general revision about the substances, the nature of the substances, what kind of substances we have. And now we talk briefly about the mental illnesses. And mental illnesses, I'm not going to cover it within like half an hour because mental illness, I'm giving these lectures to the medical students throughout the whole year. But in general, just to give you a rough education about the mental illness, they are divided into certain type of mental illnesses. Psychotic disorders, which means like schizophrenia. Everybody knows schizophrenia or schizophreniform disorder or schizoaffective disorder or delusional disorder. And mood disorder. Mood disorders mean depression, bipolar disorder, if you heard about these terms. Anxiety disorder like panic disorder and generalized anxiety disorder, post-traumatic stress disorder. Personality disorder, which has like over 10 types of personality disorders. The reason I'm mentioning these in generals, and I don't want to bother you with these names and medical terms, because there's a very strong correlation between them and the substance abuse. A lot of the time, I've seen people, they start self-medicate their mental health problem with the drugs. They don't go to the doctor. They don't go to the psychiatrist. They don't go to their family doctor. No, that's wrong. Please go to the doctor, talk to the doctor. Let the doctor give you the exact diagnosis. Don't depend on whoever refer you to somebody, give you, medication, different medication. I have seen people treating their depression with opioids, with Percocet, or with marijuana, or treating their anxiety, with cocaine or something. That's not correct. So for us as a psychiatrist in our practice, if we get any patient with mental health problem, actually, we have to rule out if there is any substance abuse. So there is no way that we do psychiatric evaluation without asking the patient, do you use the drugs or alcohol? Because it's very important. The reason it's important because they are connected with each other. The drugs might cause mental health problem, and the mental health problem could be treated or self-medicated with the drugs. So we have to search for that, either pills or alcohol or injections, all kinds of drugs. And when I said there's correlation, the studies showed there's 47% of people with schizophrenia or psychotic disorder, they are either dependent on alcohol or drugs, or people with psychotic disorder, they have 4.6 times to use alcohol than normal people who don't have psychotic disorder or schizophrenia. And with the drugs, they use drugs 6 times compared with the normal people. So if you feel, or if you see any family member or friend who has anxiety or depression or any problem, we need to address that, because this is the first step. If you leave that person by his own or her own, they will rely on drugs or alcohol to self-medicate their problems, and they are not going to treat their problems, and they are going to be addicted to drugs, and the problem will be doubled. We call it dual diagnosis, which means 2 problems in one person: the mental health problem and the substance abuse, and it's very resistant to treatment. Substances associated with psychosis. Alcohol might cause psychosis, cocaine might cause psychosis. When I told you don't, use like Adderall or Ritalin or Concerta offered to you by a friend or somebody, it might cause psychosis. That's how it's bad it is. Hallucinogen, ketamine might cause an opioid might cause psychosis as well. So there is no safe drug. Anxiety disorder in general, we talked about that, and also they are very, correlated with the drugs, and sometimes even the substances induce. We have a diagnosis in the DSM-5, which is substance-induced anxiety disorder. That means the person is not anxious, but he has or she has anxiety because of the drug they are using. So now the drugs is causing mental health problem. Other disorders self-medicated with the drugs is obsessive compulsive disorder. Obsessive compulsive disorder, people who like to put things in order, they want their cloth to be like in color coded, they wash their hands several times, they want to check the locks of the door. I remember like 15 years ago, I used to have a patient who is obsessed with iron. When he iron his cloth, he wants to be sure that the iron is off of the power jack. So he takes it off, and then he said, did I take it off or not? He goes back and forth several times, and he's not satisfied until he put the plug onto his palm to see the mark. So, now I'm sure that it's not plugged in. So this is the obsessive compulsive disorder. Body dysmorphic disorder. We have our friend here, Michael Jackson, was a good example for that. Hoarding disorder, people who collect stuff, they don't need it, they buy stuff they don't need. This is another obsessive compulsive disorder. Trichotillomania, people who are pulling out their hair or their eyebrows, or their beard, or this is a problem. This is a mental health problem. This is called trichotillomania. Excoriation disorder, people who try to wash their hands several times because they have phobia from germs. So all these problems, sometimes we don't pay attention to them, and sometimes we try to self-medicate them the wrong way. So we have to seek treatment for this problem. So as we said, we're just wrapping up, the correlation between mental illness and substance abuse. Most of people, they self-medicate mental health problems with drugs. There is impulse control disorder. People with bipolar disorder, they cannot control their impulses. They do stuff without thinking about the consequences. And this is very important and very serious. Psychosocial stressors. People, they have financial problem. They have a problem at home with their wives, wives with their husbands, with their kids. Some problems overseas. This is the time when we need help. Legal problems, all kinds of legal problems, school and job related problems. So this is general, information about the substance abuse, the mental health problems, the relation between them, and why we are talking about them. Is it important to talk about it or not? The second part of it, which is going to be the last part, is case scenarios. These are real patients. They are my patients. I have been treating them. This first case scenario is opioid dependence scenario. This lady is a 37-year-old Caucasian woman. She is single, divorced, and has no kids. She was a pharmacy student when I started seeing her back in 2012. She had some cosmetic surgery, and she started a prescribed Percocet 5 to 10 milligrams. Then the pain didn't relieve, and she liked the effect of opiates, so she asked for more. The doctor didn't prescribe her. She started buying off the street, and then she hooked up to heroin. She dropped off school. She was a pharmacy student, and she lost, the school. And she had legal problems because she was charged with petty theft, and she stolen some narcotics from the pharmacy. So when I saw her, she started treatment with me, and in 2012, she was like losing everything. She didn't stop crying in my office. She said, I lost my life, I lost my family, nobody wants to be around me, I'm dropped off the school, I was expecting myself to be a pharmacist. Now I'm selling my body to get, money for the drug dealers to get access to heroin. So I put her on the Suboxone program and started treating her. She had dual diagnosis, which means two problems, as we just mentioned earlier. She had an anxiety disorder and bipolar disorder, so I was treating both the mental health problem and the substance abuse. She recovered from the addiction. She went back to school. She finished her school, pharmacy school. She passed her board exam last year. Now she is working as a pharmacist, and she's successful in her life, and she gets her life back. So she was about to lose, everything, and now she is very successful in the community. So this is one of the examples. The second example is the alcohol example, and this is 38 Hispanic man. I met with him like 5 years ago. He started using at age 12. And he was using like around 1 pint to 1 liter of vodka per day. He was on a treatment for almost 10 times. He got admitted to the hospital. I admitted him under my service like 3 or 4 times. Detoxify him from alcohol, he get better, he doesn't have any physical symptoms, then he leaves. He started drinking again, he relapsed again, he comes back to the hospital. He has very strong family history of alcoholic. Both parents were alcoholic. So he ended up with liver cirrhosis. And alcoholic liver cirrhosis is one of the long-term consequences of alcohol drinking. And not just that, actually, with hemorrhagic pancreatitis, which is one kind of serious pancreatic inflammation. And then eventually he had liver failure. So there is no way to do anything, with his liver. So he was on the liver transplant list. This is one of the pictures. Because one of the consequences of the liver failure and liver cirrhosis is ascites. Ascites means like filling of, because the liver is the main organ in the body, is responsible for manufacturing of a protein. So if the liver fails, no more protein in the blood. And you studied that in the osmosis in physics. If there is no substances, or there is no salts, or there is no protein, the osmosis will change to start collecting liquids on his belly. So he was going to the hospital every month or so just to get this fluid out of his belly until he finds somebody, to get the liver, like an accident or so. So this is very disastrous. This is one of the consequences of the alcohol dependence. The third case scenario is the cocaine dependence. This is a Middle Eastern person. Actually, he's Arab. He's single, has no kids. He was working in a bookstore. And he started, he was by himself. He feels bored. People get into the stores, sell him some coke, crack cocaine. He started using small, then he liked it. He felt more energetic. He can do a lot of things. So he got dependent on it. And then he started using 2 to 3 grams per day. And no reason for that. He just liked the effect of it. So if there is no reason, we call it recreational use. It's not for self-medicating or anything. He was in a treatment once, then he relapsed. And then, unfortunately, he ended up with, if you remember a few minutes ago, we talked about the consequences of cocaine and the effect of cocaine on the blood vessels, whether in the brain or in the heart. So he ended up with massive heart attack and intracranial bleeding. And he's disabled in a wheelchair. So he's 35 in a wheelchair, and he wasn't sick at all. So you can imagine how bad is it. The fourth case scenario is another opioid dependence. We talk about one case who was successful. She was able to get it treated from drugs, and she was successful in her life. This lady, she's a 25-year-old Caucasian woman also. She was single. She had one daughter, age 6 years old. She started using Vicodin and Percocet, like 30 to 60, snorting them. And the reason she started, because when she had her first baby, she had postpartum depression, which is very common. Because of the hormonal changes when the lady gives birth to the first baby or the second baby, and there's hormonal changes, some they develop depression. So she started using drugs to self-medicate her depression, which, as we said, this is very wrong, because now she got dependent on a drug, and she cannot get the same benefit from pills, so she started using heroin, 0.5 to 1 gram every day, intravenously. She was injecting that. This lady, her dad is a doctor, so he has money. So he was able to get her treatment because she had hepatitis C. Hepatitis C is one of the consequences of intravenous drug use, as well as HIV and AIDS. The new drugs called Harvoni, which is for the treatment of hepatitis C, it costs $80,000. $80,000 to get a cure from hepatitis C. So imagine that, think about it. She's 25, she is healthy. She got herself sick because she was using drugs. she developed consequences and complication of the drugs and hepatitis C. And she spent, or her dad spent, $80,000 just to get her treated for the hepatitis. And then she relapsed. After he spent all this money, she got treated from the drugs, from hepatitis. By the way, the cure rate for this medication, that's why it's expensive, is 98%. It cures the patient if they use it for 3 months. But she should be like grateful for her dad, who spent all this money. What she did the opposite. She left the hospital. After a couple months, she started using again, and she relapsed. And this time, she started having HIV and AIDS, and she is currently receiving treatment for AIDS. These are 2 pictures of the hepatitis C and the complication. 2 cases I have seen, they were not my patient, that's why I put confidential cases, because they are not mine. I didn't even put the initials of those people. But I wanted to share with you 25 and a 21-year-old. They are young college students. They are Arabs. They lost their life over the last 2 years. Their family found them dead, and they were both opioid dependent. So it's a very major crisis. It's a very serious problem. The reason I talk about it, and I brought real case scenarios just to let you know how bad it is and how serious it could be. So as I told you, I want this just kind of give you a rough idea, but the second half of the lecture, I want it to be like questions and answers. And if you don't ask, I will ask you. So I'm not threatening you. Any questions?